impacted by this virus. In fact, young people disproportionately are the ones testing positive in the state of California. 50% of the 2,102 individuals that have tested positive, 50% are between the age of 18 and 49. I'll repeat that. Half of those that have tested positive to date in the state of California are 18 to 49 years old. This disease impacts everybody. The question is the acuity and the hospitalization rate that, yes, does skew on the side of older populations. But with this tragic now death, it is a reminder to everybody to take this seriously. It's a health crisis. It needs to be met first and foremost head on as such. And that's why it is incumbent upon all Californians to continue to take our stay-at-home order seriously, to continue to do the kind of social distancing that common sense dictates, and to heed the warnings we advanced yesterday to stay out of settings like beaches and parks where you're coming into close contact with others. Practice social distancing. And we had to step up our enforcement yesterday as it relates to shutting down those parking facilities as a consequence to reinforce and remind people of the seriousness of the moment. But what more evidence do you need of the loss of a young person's life? And so I just cannot impress upon the young people out there more the seriousness of this moment and how critical they are to ultimately getting us on the other side by practicing that social distancing that we all are accustomed to hearing, but not in every case advancing individually. By the way, for those that are curious, 26% of individuals 50 to 64 are represented in the 2,102 individuals that have been tested positive. 23% of all the other cases are represented in individuals north of 65 years old. The hospitalization rates tend to skew higher in those cohorts, but the number of positives, again, remains half, 18 to 49. So broad strokes, that's been most of the day as it relates to operationalizing a lot of the work that we've been talking about in the last number of days. Had a number of conversations with governors across the country about protocols and procedures to better work collaboratively on procurement strategies. We actually are lining up and linking together our procurement teams with other states to make sure that we're not competing with one another. We're making sure we are price conscious and dealing with the issue of price gouging, comparing best practices with state attorney generals, not just the work that the federal government's doing, William Barr and others that we were pleased to hear announced yesterday. So those are good conversations, and those conversations we hope will be made real in terms of organizing in a more deliberative and strategic way the procurement of the hundreds of millions of individual items that we need to procure in shields and gloves and gowns and coveralls and face masks and swabs and the like. We have testing numbers. The testing has significantly increased across this country, but also in the state of California. Tomorrow we'll be laying out the new numbers that we have received that will show a significant jump in the numbers we've made public as we brought together all of these one-off collection sites and all of the hospitals, research universities that are participating, as well as the private labs. And we'll have a new process to collect those numbers in real time to bring to light, I think, more comforting numbers on the scale. The testing is still not close to where we need to be. We still need more swabs. We still need more reagents, these RNA extraction kits, but we are seeing higher throughput, and we're seeing new technologies coming to bear. We're testing, working with the FDA, Trump administration, to get out on the market. One, I was meeting with folks today that have a 45-minute test, because the issue now is not just swabs and RNA extraction and reagents. It's about turning around the tests, which are in some cases taking days and days and days. Some cases, many as 7, 8, 9 days. And so we're going to have to address the timeliness of the diagnostic and the test results as well. Again, you constantly have to iterate in this space as we moved from just public labs to those commercial Quest and LabCorp, now to needing specimen samples, swabs, and the media associated with that, to now making sure we turn around these tests in a much quicker time. But more on that tomorrow. We also, in closing, have done a lot on the ventilator side of things. I mentioned yesterday the heroic work of Elon Musk, who came through on his promise to deliver over 1,000 ventilators, and that was announced yesterday. We have brought in ourselves, we just got another 1,010 ventilators from the private sector. We're working with Boom Energy and others to convert that cache of 514 ventilators that we had, to refurbish them and to get them fully operational. We have received from the federal government no direct ventilators from the national stockpile. Los Angeles County did receive 170. They have a unique relationship to the national stockpile, but that's all we received within the state of California proper. But we're not discouraged by that. We are encouraging the federal government, and we have direct orders and asks in to do more on the ventilators, but we are doing everything we can to orient our efforts around the world to get more ventilators in the state. About 3,000 we've been able to bring online. A community college system, I was talking to the head of the community college system, which are also been heroic in this. They provided, just as one example, 60 ventilators, and they're also keeping, by the way, all of us safe, because let's remember, the community college system is the backbone of our training in the state of California. By some estimates, 70% of our first responders, however one would define them, are trained through that community college system, and they're doing heroic work in this state as well. I only offer that because of the conversations we had today, and they deserve to be highlighted. Protocols continue to make sure that we have safe logistics and supply chain. We're working with our ag community. We're working with those that are warehousing our food, making sure those supermarket shelves are stocked. I know people are calling in, concerned not just about toilet paper, bread, and the like. I've had some very comforting conversations from grocers, their representatives, and the ag community, that they feel like they're up to the task to meet this moment. There's some protocols shifting away from, in some cases, choice to quantity as purchasing habits are changing, and some of the procedures and protocols around his distribution channels are also changing. The supply chains are changing in real time. But as you know, we are supplementing our workforce in that respect, and making sure that people know there are over 10,000 jobs available for our grocers. In that scenario, they're hiring. And I know people want to hear that, because our unemployment insurance system is being overwhelmed, and I want folks to know we've made some real shifts on staffing today. We'll be doing a lot more in the coming days to meet the demands. It's now averaged over the last 7 days, because of a huge increase, even yesterday, of 114,000. It's the 7-day rolling average of the number of unemployment insurance claims that have been requested in the state. Remember, it averaged before this crisis about 2,500. So we had a very robust conversation today with our team to they are addressing the UI requests that are coming in. So that's broad strokes an update on where we are today, and tomorrow we'll be talking a lot more about economic issues, mortgage-related issues, foreclosure-related issues. I will update on the testing, and of course, I'm here for our Facebook friends to answer any questions you have this evening as well.
Governor, a lot of people are asking, will California also open in April?
Yeah, well, the question of whether California will open in April, let me be sober about that. I'm not Pollyannish about any of these things. I referenced a 17.5% increase in the number of positives. I talked about the fact that our testing protocols have significantly increased, but I also mentioned that not all those tests are back. Thousands and thousands of people have been tested. We're waiting for their results. And we clearly, based upon the curve, have a lot more work to do. If Californians continue to do more and do better, as they have, and I'm really proud. Look, this state started on this journey, working originally with the federal government on the repatriation flights from overseas. And we started to socialize COVID ID in the state of California before probably any other state because of that unique repatriation strategy. It was highlighted during the Grand Princess efforts, and I'm very proud of those efforts. So we didn't have a Diamond Princess issue. The Grand Princess, we were able to work as well to highlight this issue in the region. We went forward with those stay-at-home orders for our seniors earlier on in this process. And of course, California moved formally with the cities and regions leading first, and then as a state at scale with the stay-at-home orders. So we're trying to bend that curve, but we haven't bent it. And so the question is, early April, I think that would be misleading to represent, at least for California, that will be the case. I've said this very honestly and objectively based upon all the expertise and experts that are here assembled and those we contact and work with, that the next 6 to 8 weeks will be pivotal, and will be determinative in terms of being able to make adjustments and be able to sort of reset expectations. I said 8 to 12 weeks because soberly we look out over the course of the next 8 to 12 weeks, and I think we can continue to do what we've done. And if we do that, hopefully then we'll be in a very different place than we are today. But I think April for California would be sooner than any of the experts that I talk to would believe is possible. Well, my message to people buying toilet paper is get what you need, not more than you need. I've got a family of 4, and we scurried around to a few different grocery stores, and they were out, and we finally found toilet paper. I will just say this, no reason to hoard the toilet paper. All the folks I talked to, I had deep conversations, not just passing conversation, casual conversations with the grocers, with all our supply chain. And I'm confident in our capacity to deliver toilet paper. But if you're going to do massive hoarding, that just makes it more challenging in certain locations in this state. So just be thoughtful, not just about your own needs, but also be thoughtful about the needs of others.
What is the percentage of recoveries to infections?
We're getting those direct stats. In fact, the hospitalization number, those stats, we're going to have more formal stats on that tomorrow. Well, we have a very detailed site, covid19.ca.gov, that lays out what is essential and non-essential. We put together a very comprehensive list, working with health directors throughout the state of California, working with counties, working with city leaders throughout the state. In fact, I was talking to one other governor today that had a recent stay-at-home order, comparing and contrasting notes, what worked, what didn't, what was most controversial, what wasn't. So it's a sheet that is iterative, and it's a sheet that is available, a list, a comprehensive list that's available. And I encourage people to go to that covid19.ca.gov website to learn more. And when in doubt, go to your county health department that also has those resources available that will localize them in a way that also, I think, could guide a more direct answer to that question. So that's it in a nutshell. We'll be back tomorrow to more formally update everybody on where we are. Everybody stay safe. Most importantly, stay healthy. And let's continue to meet this moment as California is leading in terms of these efforts. Let us continue to lead, and let us continue to lean forward to recognize our responsibility. Let us not have to once again announce that a teenager lost their lives because we didn't take this moment seriously. Let us take this moment seriously and soberly. Let's live our lives, but let's do it by being thoughtful about how we meet this moment. Take care, everybody.